Sleep is your friend, not your foe, when understood correctly. The link between oversleeping and stroke risk is an important reminder that our bodies are complex systems and all unusual signs need to be listened to and understood. Sleeping a lot isn't always bad, but when it becomes a prolonged pattern accompanied by fatigue and low energy, it could be a warning letter from your own body. Instead of panicking, act proactively. Reevaluate your lifestyle, seek professional medical advice, and commit to comprehensive health care. Prevention is better than cure, and early recognition of potential risks is the key to protecting your precious brain from the specter of stroke, paving the way for a healthier and fuller life. Sleep, when regulated and placed within the broader picture of overall health, will always be your reliable companion. Sleep, trusted friend, or a silent risk for stroke. We're taught that sleep helps the body heal, but not all sleep is created equal. When you sleep more than 9 hours a night or take extended naps and still feel exhausted, your body may be raising a silent alarm, a signal of chronic inflammation, cardiovascular strain, or blocked arteries quietly brewing underneath. Don't wait until a stroke strikes to realize what your body was trying to tell you. Start listening now. Reset your sleep routine, get regular checkups, and protect your heart before damage is done. A simple shift today could save your life tomorrow. Reevaluate your overall lifestyle. Diet. Are you consuming too many processed foods, sugary items, and unhealthy fats? Increase your intake of vegetables, fruits, whole grains, lean protein, and healthy fats. Physical activity. Are you getting enough exercise? Aim for at least 150 minutes of moderate intensity activity per week. Stress. What is your stress level like? Find effective stress management techniques, such as meditation, yoga, or spending time on hobbies. Sleep quality. Is your sleep environment conducive to good sleep? Quiet, dark, cool? Do you have a regular sleep-wake schedule? Regular health checkups. Don't wait for symptoms. This is the most crucial step. Share your unusual sleep habits with your doctor, along with any other symptoms like persistent fatigue, shortness of breath on exertion, headaches, dizziness, unexplained weight changes, loud snoring, or witnessed apneas reported by a bed partner. Your doctor can order the necessary tests to screen for stroke risk factors: blood pressure measurement, blood tests, blood sugar, cholesterol levels, liver and kidney function, inflammatory markers, an electrocardiogram or ECG to check for heart problems. In some cases, more specialized investigations, like an echocardiogram or heart ultrasound, or a sleep study, polysomnography, to diagnose OSA may be needed. Treat underlying conditions, if any. If diagnosed with conditions like hypertension, diabetes, dyslipidemia, heart disease, OSA, or depression, strict adherence to your doctor's treatment plan is paramount. Effectively managing these conditions will not only improve your quality of life, but also significantly reduce your stroke risk. Optimize sleep hygiene. Maintain a regular sleep schedule even on weekends. Create an ideal sleep environment. Avoid stimulants like caffeine, nicotine, alcohol close to bedtime. Limit exposure to blue light from electronic devices before bed. Relax before bed. Read a book, listen to calming music, or take a warm bath. Mechanism. Heart problems such as heart failure, arrhythmias, or undiagnosed coronary artery disease can reduce the heart's efficiency in pumping blood. When the brain doesn't receive enough blood and oxygen, the body may respond with fatigue and an increased need for rest and sleep. Linked to sleep. Fatigue due to heart disease is a common reason for patients to sleep more. These very heart conditions are leading risk factors for ischemic stroke, caused by a blood clot traveling from the heart to the brain. Sleep-disordered breathing. Obstructive sleep apnea. Mechanism. OSA is a condition where the airway repeatedly becomes blocked during sleep, causing short pauses in breathing. This leads to drops in blood oxygen levels, increased blood pressure, and stress on the cardiovascular system. OSA is an independent and potent risk factor for stroke. Linked to sleep. Although individuals with OSA experience fragmented and poor quality sleep, they often feel very sleepy during the day and may have a longer total sleep time, including non-restorative naps, in an attempt to compensate for energy deficits. Depression and other psychological conditions. Mechanism. Depression not only affects mood, but also causes biological changes in the body, including increased inflammatory markers and effects on vascular function. Linked to sleep. One of the common symptoms of depression is sleep disturbance. While some suffer from insomnia, A significant proportion experience hypersomnia, excessive sleepiness, as a way the body copes with emotional and physical exhaustion. Sedentary lifestyle and poor physical condition. Mechanism. Lack of physical activity increases the risk of obesity, high blood pressure, diabetes, and other components of metabolic syndrome. Linked to sleep. People who are sedentary often have lower energy levels and may feel the need to sleep more. This vicious cycle, inactivity leading to fatigue, fatigue leading to more sleep and even less activity, can escalate health risks. Oversleeping, an SOS signal from your body. From the analysis above, it's clear that instead of viewing excessive sleep as a mere bad habit, we should perceive it as a potential SOS signal that the body is trying to send. It could be a warning that something isn't right internally, demanding attention and timely intervention. Ignoring this signal, or simply trying to cut back on sleep time without addressing the root cause, can lead to serious consequences. Like turning off a smoke alarm without putting out the fire, you are allowing the risk to smolder and potentially erupt at any moment. Listening to your body. What to do if you oversleep. If you find yourself regularly sleeping more than 9 hours a night, or taking unusually long naps and still feeling tired and lethargic upon waking, don't be complacent. Here are the steps you should take.
These numbers aren't meant to instill panic, but to make us more aware of a factor that can affect cerebrovascular health, which has previously received less attention. A stroke, or cerebrovascular accident, is a medical emergency that occurs when blood flow to a part of the brain is blocked, or a blood vessel in the brain ruptures, causing irreversible brain cell damage. Its consequences can be permanent disability or death. Decoding the complex link. Is oversleeping a cause or a consequence? This is the pivotal question that science is diligently working to answer. Does the act of sleeping too much directly damage blood vessels, or is it merely smoke signaling an underlying fire within the body? Most experts lean towards the latter hypothesis. Excessive sleep is often not the direct cause of stroke, but rather a symptom or early warning sign of other underlying health issues. And it's these issues that are the true culprits increasing stroke risk. Let's examine the main suspects. Underlying chronic inflammation. Mechanism. Low-grade chronic inflammation in the body is a proven risk factor for cardiovascular disease and stroke. This inflammation can stem from various sources: an unhealthy diet, high in sugar, trans fats, processed foods, obesity, chronic stress, or autoimmune diseases. Link to sleep. When the body is fighting inflammation, it consumes more energy and releases sleep-inducing cytokines. This can lead to persistent fatigue and an increased need for sleep. Long sleep duration itself might also increase some inflammatory markers in certain individuals. Metabolic syndrome, the hidden enemy. Mechanism. This is a cluster of risk factors including abdominal obesity, high blood pressure, high blood sugar, prediabetes or type 2 diabetes, and abnormal cholesterol and triglyceride levels. Metabolic syndrome significantly increases the risk of atherosclerosis, or hardening of the arteries, blood clot formation, and consequently stroke. Link to sleep. People with metabolic syndrome often feel lethargic, lack energy, and may sleep more. Conversely, some studies also suggest that irregular sleep habits, including both too much or too little sleep, can contribute to metabolic dysregulation and worsen this syndrome. Underlying cardiovascular disease. Recent studies have caught the medical community's attention, revealing a clear connection between prolonged sleep and a higher rate of stroke, especially among middle-aged and older adults. Ask yourself this: do you often sleep in on weekends? Have you ever taken a 2 to 3 hour nap and still felt groggy, heavy-headed, or mentally foggy? If this happens frequently, your body may be trying to warn you. Many people assume that sleeping more is a way to catch up on missed sleep during the week. But in reality, regularly sleeping more than 9 to 10 hours a day, particularly during the daytime, can disrupt your circadian rhythm, throw off your heart's rhythm, raise your blood pressure, and reduce the elasticity of your blood vessels. All of these are key risk factors for stroke. Large-scale studies have shown that individuals who sleep more than 9 hours per night have a 23 to 85% higher risk of stroke compared to those who sleep 7 to 8 hours. In this article, we'll explore the biological mechanisms behind this phenomenon. Why can oversleeping disrupt blood circulation to the brain? Why might chronic sleepiness not just be fatigue, but a hidden sign of cardiovascular or neurological issues?
Most importantly, we'll look at expert insights from neurologists and cardiologists. How do they interpret the latest research? Who is most at risk? And how can we establish a healthy sleep routine that allows the body to recover without causing harm? If you or someone you love sleeps excessively yet still feels tired, don't ignore what your body may be trying to say, because by the time a stroke strikes, it's often too late to turn back. What does the research say? The sobering statistics. Let's start by looking directly at the scientific evidence. A large-scale cohort study, published in reputable medical journals, followed tens of thousands of adults for many years. The results have undeniably caught the attention of the medical community and the public. The danger threshold. Individuals who regularly sleep more than 9 hours per night have a significantly higher risk of stroke, approximately 23%, compared to those who get adequate sleep, 7 to 8 hours. Extended naps. It's not just nighttime sleep. Naps lasting over 90 minutes also show a similar increase in risk. The alarming combination. Most concerningly, when these two factors combine, individuals who both sleep long hours at night and take long naps, their stroke risk can skyrocket by up to 85%. Quality over quantity? Even with adequate sleep duration, individuals who report poor sleep quality, difficulty falling asleep, frequent awakenings, not feeling refreshed upon waking, also have a higher stroke risk, around 29%.
Before we go deeper, I want to share a story that just happened in Wisconsin. Walter, 68 years old, has always considered himself a healthy sleeper. Ever since retiring, he started sleeping in until 9 or 10 every morning and napping after lunch, sometimes up to 2 hours. His wife thought he just needed the rest. But over the past few months, Walter began to notice something strange. He'd wake up feeling foggy, heavy, and exhausted, despite sleeping nearly 10 to 11 hours a day. One afternoon, after dozing off during his favorite baseball game, he stood up and suddenly felt dizzy. Within minutes, he was slurring his words. He had suffered a minor stroke. Doctors at the ER told him something that shocked him. "Walter, this might have been building for years. Your excessive sleep isn't rest. It's a signal your body's struggling." That moment changed everything for him. He now follows a strict sleep routine, checks in regularly with his cardiologist, and most importantly, he listens to what his body was trying to tell him all along. Stop this sleep habit now to prevent stroke. Sleep, a healing remedy or a double-edged sword? Sleep, silent healer or hidden trigger for stroke? Most of us understand that sleep is vital for physical renewal and mental clarity. During restful sleep, the brain flushes out toxins, the immune system resets, and your heart gets a much-needed break from daily strain. But while we often hear warnings about sleep deprivation, there's a quiet danger on the other end of the spectrum. Could oversleeping, especially more than 9 hours a day, be silently damaging your cardiovascular system and increasing your risk of a stroke?